All right, so with this PowerPoint, we're going to talk about anti-inflammatories. This isn't a super long one, which is good. All right, so primarily with anti-inflammatories, we're talking about pain management. So pain is an unpleasant sensory and emotional experience associated with actual or potential tissue damage. Pain can be good in a good way. I know that sounds weird, but it allows animals to avoid bad things. So um, say you have a like a hot plate or like a hot surface and you're like, oh, I hope that's not hot. You touch it and you're like, oh, now I know for future reference that that is going to be hot from now on. And so it teaches animals to avoid things that would cause them pain. Bad pain is we can see increased stress, GI lesions, immunosuppression, delayed healing, hypertension, and dysrhythmia. So these are all really bad pain. So if you have like a chronic pain or these animals have like arthritis, for example, um, that pain itself can lead to other things just besides being seeing pain in that one area that is affected. Historically, animals do not feel pain. So back in the golden days that when we didn't have much knowledge on animal behavior and things like that, we didn't think that they feel pain. Animals don't show pain the way humans do. For us, we will scream, yell out. We're like, oh my God, avoid, flinch, things like that. With animals, depending on the type of animal, most of the time, yeah, they're unless it's true pain, most animals are not going to really react to this. And so historically, we would think that they do not show the same pain that we do. This isn't necessarily a true statement, because animals do show a lot of pain, whether it's crying out, um, physically, holding up a limb, things like that. This statement is not true at all. And so, why do animals not show pain the way we do? So, if we think about it in nature, so if we think of like a prey animal, so say like a deer or something, they're going to do everything in their power to not show that weakness, so that way they don't get eaten. And so that for them is a defense mechanism, so that they don't, become true prey to a predator of some sort. Some signs of pain, we can see increased heart rate, increased respiration rate, increased blood pressure. Mydriasis is dilation of the pupils, salivation, vocalization, change in facial expression, guarding, so like an injury or something, restlessness, unresponsiveness, decreased grooming, abnormal gait, abnormal stance, rolling. Rolling we see a lot with horses. If they're having a GI pain, they will just start rolling all over the place just to see if they can help alleviate that pain. Always and take a second too to think of like other signs of pain that you think animals might express, either from your own experience or that you would just think that they would experience. There is a way to track pain. So we've gone over into the clinic and we've seen this scale before. This is put out by Colorado State University teaching hospital, and it is a pain scale of 0 to 4. And so our 0 means that they're not experiencing little to like absolutely no pain at all whatsoever. So you can touch them all over the place and they'll be fine. Versus 4, they are in excruciating pain, may be painful to move, may act regressively when touched, groaning, screaming, difficult to distract from the pain. So these guys are really laid out, and we got to fix that really quick because we want them to be back down here for sure. 2s and 3s are uncomfortable for sure. So take a look at this graphic. It's very informative as well. So pain management standards, this comes back to our lovely AHA, American Animal Hospital Association. So pain assessment for every patient is regardless of presenting complaint. So no matter what they're coming in for, if we're doing vaccines to if we're doing full-blown orthopedic surgery or removing a limb, everyone's getting a pain assessment to see how much pain that they are in or how much pain, possibly due to a procedure we're going to inflict on that patient. Assessment is recorded in the medical record at that point, so that way we have documentation of it. Use of preemptive pain management as well. Before we start any procedures, if we know that it's going to be a painful one, we're going to use pain management before we even get started. Appropriate pain management for anticipated level and duration. So depending on how long our surgery is or how long, how painful this whole process is going or healing, things like that, or if they're on chronic, if they have a chronic condition, they need to be on pain management for a long period of time. We're going to use appropriate pain management for them at before we even get started. Pain management with all surgical procedures. I don't think I'd be one of the wanting to go through surgery without any pain meds. Just throwing that out there. Reassessment for pain throughout procedures as well. We can see, even under anesthesia, we've kind of talked about it before, that we can see that they actually will it will affect their level of consciousness, in regards to what pain that they're receiving in surgery. This goes for people as well. This is why we have that anesthesiologist who is dedicated to monitor vitals and gas levels and things like that, so that way they can monitor pain response. Medical and chronic pain is also treated. We will use a lot of pain management for like animals with arthritis or animals that have chronic pain conditions, things like that. We'll talk about anti-inflammatories mostly, or other pain medications that we use. There's always going to be a written protocol on what to use and when to use it. And then we're going to teach clients to recognize pain from their pets. Our owners are going to be our first line of defense for these guys because they're going to see their animals in an everyday situation. They can present at the doctors and be like, oh, of course they're not limping today, but they've been limping for the last 3 weeks. So again, teaching our clients to recognize these signs is going to really help that animal in the end. So our pain pathway here, there are 1, 2, 3, 4, 4 different ways that not 4 different ways, 4 processes that pain message gets transported to the brain. So we start here at transduction. So transduction is a stimulus to the nerve ending, or that translates pain message. So this means, like, say the dog stubbed its toe, and so if you stubbed your toe here, that pain is right here, and it's traveling up your nerves, and transmission is sending that message to the central nervous system. We'll talk about what inhibits these things here in a minute. So that's getting transmitted up the nerves, and it's reaching up into our spinal cord, where modulation is going to happen, and where that message is getting transported up to the brain, and it's changing so that way the brain can understand what's going on. And then perception is up here, is where the brain's saying, ow, I actually stubbed my toe on the coffee table or whatever. And so that's the brain interpreting that message. So when we're talking about if you read the graphic here, these things are all inhibited. That means that different types of medications are going to stop the pain pathway at different points here. So whether it stops at perception, stops it down here in the spinal cord, down here in transmission, or on a local setting, so right at that pain stimulus, that's where these pain medications are going to do their job. So not every pain medication that we use affects every point of this pathway. So just be aware of that as well. So prevention is the best medicine when it comes to pain management. Treat pain before it occurs, and then again at regular intervals. We're going to treat anticipated pain and avoid spinal cord windup. So what this means is that the chronic pain resets threshold to a lower level. So it's so painful that it just winds right back up, and you don't really get any relief no matter what happens. We can see hyperalgesia, so less stimulation is required to initiate that pain. So this pain is so prominent that even after it goes away, like even just a slight touch of it, you're like, oh my god, that's super painful. Or allodynia is normally a harmless sensation of being interpreted as pain. So we can call this as well as called see this also called like phantom pain. So maybe that they had an old injury on their leg for some reason and you go to touch their leg like you're brushing or you're doing their nails and they like freak out like you're killing them. So that would be the allodynia right here for that. Or if an animal had missed a leg or something, is missing a leg, and you touch like their stump where they're missing, and that could be causing some pain to them as well. So preemptive analgesia is going to be before the pain starts. So we talked about this kind of with our pre-anesthetic stuff. Really, really important to get that on board before we start on our surgeries. Maintaining an analgesic plane. So we're going to give them that pain management and we're going to keep them under that same kind of like plateau effect in order to keep them pain free. We're not going to quit until the pain quits. So before, during, and after surgery, and then post-operatively, for the next few days until that pain subsides, we're going to keep up that pain management. Multimodal analgesia is a combination of drugs that control pain from many paths. So pain pathway can be disrupted at various points, like I had talked about before in the previous graphic up here. So using pain management to stop at different parts on that pain pathway is the gold standard. That's ideally what we want to do. Different classes work in different ways. And so that means like an anti-inflammatory is going to do a different type of pain management than like an opioid would. And so we use a lot of those in combination with each other. So our types of pain management drugs, analgesics or anti-inflammatories. So our NSAIDs, our opioid analgesics, antihistamines, muscle relaxants, corticosteroids, local, regional, and topical anesthetics as well. Chondroprotectives are going to be Adequan. We're not going to talk a lot about Adequan. Adequan is like it's a really nice, kind of like a joint supplement, but it protects the chondroitin, the chondral fluid in the joints, because once that stuff is gone, it's gone. And it helps lubricate joints and helps with arthritis. It's a injection that lasts up to a month sometimes, depending on our patients. So we use it a lot in horses, dogs, and cats. So NSAIDs are non-steroidal anti-inflammatory drugs. These are going to treat underlying problems of inflammation, and pain is reduced as a result of that inflammation. Used in mild to moderate pain and acute and chronic. So anything that has inflammation of some sort, we want to reduce that inflammation, and we want to make sure that they can recover from that. Frequently used with musculoskeletal pain, so osteoarthritis. So arthritis in different joints, elbows, hips, back, necks, things like that. Sometimes in toes. So these inhibit enzymes called cyclooxygenase or COX. So there's COX-1 and COX-2 enzymes. So these are COX-2 is thought to have fewer side effects. These NSAIDs are not as effective as glucocorticoids, so they're not as effective as the steroids, but they block inflammation earlier, also have bad side effects with long-term use. So steroids are going to work a lot better than a non-steroidal anti-inflammatory. Steroids block inflammation much earlier, but the drawback to those is that they have a lot of side effects, like animals can become, we call it roid rage. They can become altered in behavior. We can see PUPD, which is polyuria, polydipsia, which is increased urination, increased drinking. We can see kidney failure, we can see liver failure, we can see GI ulcers from these steroids for long-term use, so we have to be very careful with them. So they said back in the day, we're like, oh, well, we really like how steroids work, but we don't like the side effects. So thus creating the non-steroidal anti-inflammatory drug in its place. They're great drugs because they're supposed to work like a steroid. They do have some side effects, but not to the same extent as a steroid. So NSAIDs are going to provide analgesia. We use them a lot for post-op trauma, chronic pain, and they're also used as a fever reducer because we're reducing inflammation on the brain. Most common side effect is GI ulceration and bleeding. The rare side effects include nephrotoxicity, which is kidney damage. Um, we are also seeing inhibit of cartilage metabolism, bone marrow suppression, and reduced platelet aggregation. So that means increased bleeding. So we want to make sure if we have our patients on NSAIDs for any reason, we want to look for this. We usually look for vomiting and diarrhea, especially bloody diarrhea, if they're on any types of NSAIDs. The other biggest thing that you never want to combine an NSAID and a steroid together, because we will cause severe GI ulceration with them and they will become very, very sick. You have to be very careful of that. Meloxicam is a type of NSAID. Carprofen, Deroxib. Deroxib. There we go. I don't use Deramax very often. I've only used it a couple times. Carprofen is Rimadyl. Meloxicam is Medicam. Firocoxib is Previcox, and Tepozalin. There we go. Or Zubrin. Phenylbutazone. Flunixin. Meglumine, I can say that, which is Banamine. We use this as an analgesic and antipyretic, mostly in large animal. Banamine, phenylbutazone is bute in livestock. The most common ones we're going to use in small animal practice are Previcox, Deramax, Rimadyl, and Meloxicam or Medicam. Majority of these guys we usually see them as a generic. There are like 5 quadrillion different brands of carprofen out there. Vetprofen, Keyprofen, things like that under the sun, just because it is cheaper. Rimadyl is pretty expensive. Meloxicam we can use in people, and I think Zubrin you can use in people too. I'm not 100% sure. The big things with these guys as well, they are antipyretics, so they are also a fever reducer. Other NSAIDs, aspirin, acetylsalicylic acid. There we go. Struggling today. This is an analgesic, antipyretic, and anti-inflammatory. This reduces platelet aggregation, so it thins blood. So hear about people taking baby aspirins once a day. This is what they're taking. They is used for mild to moderate pain. We can use this in dogs. We don't like to give it to cats. We'll talk about why cats can't have anything because they're cats. They don't process NSAIDs very well. We don't commonly give this to dogs. Usually, we will give them other more vet approved anti-inflammatories like carprofen. Phenylbutazone, there we go, is bute, mild to moderate pain, anti-inflammatory, antipyretic. We use this a lot in horses. So bute toxicity can cause ulcers, hemorrhages in the esophagus and the GI tract, diarrhea, low white blood cell count, anemia, and intestinal, kidney, and liver disease. So we have to be very, very careful to that. Dogs, you actually can give them a dose of it as well. We don't use it commonly in dogs. Horses were to the point where, like on the racetrack, they will actually list animals that have, or like the last time that they had their bute injections for anti-inflammatory, because people, we can see these really affect conditions of horses and livestock as well. So you have to be careful of that. For our kitty cats and the aspirin, going back to that, we never want to give them aspirin. It can see decreased appetite, vomiting, diarrhea, abdominal pain, pale mucous membranes, weak pulse, dehydration, anemia, gastric ulcers, and if they are giving high dose or decent doses of it, they can be dead within a week. So never give your cats aspirin at all whatsoever, and never recommend it to a client. DMSO, dimethyl sulfoxide. There we go. Anti-inflammatory, topical application in horses. You want to make sure the biggest thing with this guy, it's a cream, or it's a type of ointment that you can slather on for like a local anesthetic. Produces a garlic taste in the mouth after application, so you have to be very careful that you don't apply this with bare hands. Can cause severe skin irritation and burning, worse if they are bandaged as well. So I have to make sure that we apply the cream and then air them out. So we always wear gloves when applying this. With ibuprofen or Advil, we don't use this very commonly in vet med. It has a very narrow therapeutic window in domestic animals, and very small changes in dosage level can lead to toxicity. So, especially in dogs and cats, so we don't use it in these critters. We can see decreased appetite, vomiting, sometimes with blood, diarrhea, depression, abdominal pain, dark, tarry stools that can be indicated of like internal bleeding, and bloody stools. Other clinical signs can include stupor, which is near unconsciousness, incoordination, increased or decreased drinking and urination, icterus, so liver issues, and they turn yellow, pale mucous membranes, seizures, and coma with these guys, especially if they eat or consume too much of it. We've seen animals come in a lot that have like gotten into their owners like ibuprofen or aspirin, things like that, and it can cause a lot of serious issues. Acetaminophen or Tylenol, this is actually not an NSAID. They are their own little funny class. And so they are still an analgesic, but they're not a nonsteroidal anti-inflammatory. This does not treat inflammation at all whatsoever. Very limited use in vet medicine, never give to cats, can cause cyanosis, anemia, and liver damage. They can also cause methaglobinemia, which is a condition of elevated methaglobin in the blood, and we can see dark tarry stools because of that. So we have to be very, very careful with using these. We never ever give Tylenol to cats. We can actually kill them with that as well. Other analgesics are opioids. We kind of talked a lot about this in the nervous system PowerPoints. So these are going to produce analgesia and sedation, reduce anxiety and fear, used as a pre and post-op anesthetic, sometimes used alone or with a tranquilizer as anesthetics for surgery, relief in colic and pain in horses. Colic is like a GI obstruction or issue. There's a couple of reasons why. There's a bunch of reasons why colic can happen. We only see it in horses. We can also use these as restraint or capture of wild or zoo animals as well, because it provides pain management and a sedatory effect. At low doses, we can also use opioids as an antitussive or an anti-diarrheal medication as well. Side effects of opioids are potent respiratory depression. This is really, really causing the body to relax and slows everything down, including the respiration. So we have to be careful of that. So this also reflects thermal regulation. So they can get really cold easily because they can't regulate their body temperature very well. Panting, defecation, flatulence, and vomiting are also side effects of opioids. These animals can also have a sound sensitivity as well with these on board. They get a little panic and freaked when they hear loud noises. Excitement in dogs if given IV rapidly, so they can go get really hyper. They're like, oh my gosh, what's happening? I don't know what's going on. And so we have to bring them back down. We don't want to give it too fast to them. Cats and horses, because cats are essentially horses, and as horses are essentially cats, are very sensitive to opioids. Excitatory effects at high doses. So some of our cats and our horses do not tolerate opioids very well, so they can become over hypersensitive if given too much opioids long term. Naturally occurring narcotics that we can see. This again should be a little bit of review, so we won't spend a ton of time on this. Opium is used to treat diarrhea in calves and foals. I just want to know how they get it. I honestly have no idea how they get legit opium for these guys. Morphine, used to treat severe pain, class 2 controlled substance, gold star standard for analgesia. Some synthetic narcotics, these are man-made. Mepridine, there we go, which is Demerol, oxymorphone, butorphanol, fentanyl, and buprenorphine. These are all synthetic narcotics. If you look at some of them are 4 to 7 times, 10 times, or stronger than morphine, because we wanted to make morphine better and stronger, and so we created all these. Local and regional anesthetics. These are going to block transmission of painful signals at the site of the pain stimulus. So, like, if we were giving an incision, or if we were Taking a mass off, we would give it right under the skin, right where that blade is going to cut around the mass. So we use them a lot for nerve blocks and dentals. So if you've ever had lidocaine or the Novocaine or bupivacaine, that is a local block. We'll also use it for lameness as well, to help alleviate pain in that area. Splash blocks, we just splash a little bit of liquid local anesthetic on our site. And then also local infiltration. So that means that we're injecting this local anesthetic into a specific area. So that way it spreads and it numbs just that one area that we want it to. Lidocaine and bupivacaine are most common two regional anesthetics that we use. Bupivacaine lasts longer in the body than lidocaine does. So if we're doing just short-term procedures, we'll use lidocaine. If we want long-term analgesic effects, we will use bupivacaine. We have to be careful how much lidocaine we give because that can also affect heart rhythms as well. So be careful of that. Regional versus local, the two differences. Regional is numbing sensation over a large area. So like if I was doing a regional block on a leg, or actually the best example for regional block would be a epidural. So giving a anesthetic into the spinal cord that numbs the lower half of the body for, say, orthopedic procedures, limb amputations, and people for women who are giving birth, things like that, versus a local anesthetic is going to be loss of sensation where it is applied. So whether it's by injection, we can use topical anesthetic as well to numb areas. Sympathetic anesthetics, so these are going to release inhibit the release of norepinephrine. These are going to produce sedation and analgesia. They are visceral and somatic as well. So we are talking about like on organs and in the nervous system. They are reversible with an antagonist. So we've talked about dexdomitor, medetomidine, and xylazine before, Rampon. These guys are going to be more of a sedentary effect. And they are also going to provide a little bit of analgesics. Not as much as like our other guys, but they also provide some, which is really nice. Thanks.